Wellbeing Initiative for the Nation is Samueli Institute's attempt to shift the investments the country makes into the areas that create human well-being and flourishing. We know the factors that create human flourishing. We know when individuals are well and healthy that they're productive, and that this helps all things in the country, from defense to disparities to the national debt. The Wellbeing Initiative for the Nation, or as we like to call it, the WIN, is an effort to make that shift and to bring multiple stakeholders that need to be involved in changing those kinds of investments to the table. WIN started back in 2008. In preparation for health reform efforts, we brought together a group of diverse stakeholders, from community leaders to national and federal policymakers to business leaders and others. Out of that came a document called the Wellness Initiative for the Nation. In that, we were able to contribute some of the recommendations that came out of that to the legislature, and those were incorporated in the form of a number of areas, including things such as the National Prevention Council. Several years later, we pulled together a public-private partnership called WIN2. This is a group, again, of federal leaders, of business leaders, of community leaders, academics, and others, to explore what do we mean by wellness, health, well-being, and how do we create more of it within the country. It was realized that the core factors that create human flourishing are often outside of the healthcare system. We needed to broaden into the community these same efforts. Out of the meeting of WIN2 came the need to bring an even higher level of discussion in the federal and national sectors. Our hope is that some of those recommendations that emerge will be taken up by the new government next year and extend the creation of human flourishing and well-being across the nation.